Good morning. I'm Heidi Arens. I'm a nurse practitioner here at the Center for New Medicine in Irvine, California. And today I'm going to be talking about Lyme disease. And a lot of you may be aware of Lyme disease or familiar with it. We are getting more and more questions about Lyme disease and patients coming in wanting to be tested for Lyme disease. And that's really because there's a growing epidemic nationwide and worldwide of Lyme disease. And the reason for that is we know a lot more about Lyme disease than we ever have. There's now new methods of detecting Lyme disease, and there's a lot more we can do for Lyme disease that I want to talk to you today about. Lyme disease is known as the great masquerader, and that means that it can mimic many other diseases and many other conditions. So a lot of people are misdiagnosed with having diagnoses like depression, anxiety, chronic fatigue, fibromyalgia, and they're misdiagnosed because Lyme disease can actually masquerade as those things and look and present like those things. And you can have symptoms of all of those things when you have Lyme disease. And so one of the things we want to talk about today is just what are the symptoms of Lyme disease? How do we detect it? And if you're wanting to learn more, there are other ways of evaluating for Lyme disease. It's a very difficult clinical diagnosis to make because the testing is so difficult. The testing is notoriously very poor, and that's because the detection that we have at most labs for picking up Lyme or Borrelia burgdorferi, the actual bacteria, is very bad. There's more than a 50% false negative rate, meaning you could have Lyme disease, but the blood tests don't pick it up. And those are the basic blood tests that we're all trained to order and to run when we're suspecting Lyme disease. And there's kind of two entities of Lyme disease. There can be an acute Lyme presentation, and then there can be a chronic Lyme presentation. So I'm going to talk about the differences between those things. Acute Lyme is when you actually get bit by a tick. An infected tick with the Borrelia burgdorferi bacteria or co-infection, and you develop a classic bullseye rash, a rash that's raised and red and has a central clearing in the center. And often those rashes can be accompanied by other symptoms like joint pain, muscle aches, fevers, chills, fatigue. All of a sudden you become acutely ill, sometimes with the rash, sometimes without the rash, but there's a significant point in time where all of a sudden you got very sick. And often the rash will clue us in. We can do blood tests. If we find an elevated antibody or the presence of Lyme in your body, we can treat that with a very well-known and safe antibiotic called doxycycline. And we do that for about a month. In that time frame of 30 days, typically for most people, when you have a very strong immune system, you can fight off that infection and it doesn't turn into a chronic Lyme syndrome. When you don't fight off that infection and it turns into a chronic infection, that's when we see people who are sick with the actual disease, the Lyme disease that we call it. It can be debilitating, and it can be incredibly frustrating to treat, because it can affect every system of the body from head to toe. So it can affect your neurologic system, and it creates symptoms like anxiety, depression, brain fog, dizziness. You can have electric shocks. You can have random pain. You can have poor memory, poor word recall, problems with concentration and focus. People say all of a sudden, my brain turned off. I couldn't function anymore. I couldn't learn new information. I couldn't recall the information that I once knew. I'm having trouble in work or at school. And often this is a neurologic inflammation that we're seeing, and these symptoms are a manifestation of that. It can also affect many other body systems. It can affect the lungs, where all of a sudden you get short of breath, you can't breathe, you can't take deep breaths, you begin to hyperventilate, feel like you need oxygen. And when we test you for lung infections or lung diseases, the lungs are fine. There's no asthma, there's no pneumonia, there's no pulmonary fibrosis. The lungs are fine, your oxygen levels are fine, but you feel like you can't breathe. That's a very common symptom. Other things like chest pain, chest tightness, palpitations, sweating, dizziness. You can have diffuse joint pain through most joints of the body that migrate. It goes from the ankles to the knees to the hips to the elbows to the shoulders to the back. And these inflammatory joint syndromes, they can swell, they can be red, they can be painful. And all of a sudden you're getting these random joint pains that you never had before. You can break out in rashes, you can have a lot of gut disturbances, bloating, constipation, diarrhea. It can just completely shut down the vagus nerve, and you have all kinds of different gut-related illnesses. You get told you have IBS, irritable bowel syndrome, because they can't find exactly what's going on, but you have all these gut-related symptoms. A lot of times Lyme is also accompanied by many other infections because of the fact that the immune system gets very suppressed. So there can be other infections that we may be able to detect in blood work or through stool testing or through urine testing or saliva testing. And so we see the presence of all these other infections, and along with it is Lyme, but the actual antibodies for Lyme aren't showing up, and that tends to be people who have very suppressed immune systems. But we do need to look at the overall terrain of the body, because a lot of times Lyme is accompanied with many other friends like parasites and viruses, and even other bacteria, spirochetes, and other things that are also making you sick. And it may be because of the fact that the immune system is now very, very suppressed. One of the things that we can do to detect this is we do have other labs that we use that do have better sensitivity and specificity for picking up Lyme than just the standard blood test that you can get. And so that's one resource that we do use frequently. We also use electrical testing, looking at the electrical passages of the body, the biomeridian passages that actually we can test. And that Lyme doesn't always show up in that, but it is another resource that we can use. One of the things that you may not know is that what distinguishes people who get exposed to Lyme and they're able to fight it off and it doesn't become chronic versus those who get exposed to Lyme and they can't fight it off and it does become chronic is the HLA genes, and those are genes that actually dictate our immune function. And 20% of the population has defects on those genes. So they may have a genetic predisposition towards getting Lyme, and they may go through life, never be exposed, and so they never have a problem. But say they do have that genetic predisposition, those defects on the HLA genes, then they get an exposure, and an environmental or biotoxin exposure of Lyme. It mounts a very specific innate immune response, which actually, in those people, they mount a response, but they can't mount the proper response. It's a maladaptive response, and it creates this ongoing inflammatory state. And it's not the inflammatory state that we're used to seeing in things like diabetes and heart disease and arthritis, where you have an elevation of C-reactive protein or ESR, erythrocyte sedimentation rate. Those are common inflammatory tests that we run to see, do you have general signs of inflammation? Often those are fine. So when people present and they say, I have all this pain and these joint aches and I feel inflamed and I can't think and I have brain fog, and naturally we would think, you sound like you have a lot of inflammation. But when we run the inflammatory test, there is no inflammation showing up. And that's because it's a totally different side of the immune system. It's the innate immune system where there's a problem, not the adaptive immune system. And so what we can do is we can check markers of the innate immune system. And we want to look at HLA genes. Are you someone who's genetically susceptible? And if you are, then we want to look further and say, okay, what are the innate immune biomarkers that we can look at to see, is there a syndrome going on called a chronic inflammatory response syndrome? And there are very specific biomarkers that we can look, and when those are either high or low, depending on what test we're looking at, it clues us into the fact that there's likely what is a chronic inflammatory response syndrome. And we have to stop that syndrome because it's this ongoing inflammatory state. And often what's happening is the presence of these HLA genes are creating this maladaptive immune response. And in response to that, the body gets stuck in this ongoing inflammatory state, which will then suppress the immune system to be able to fight off the infection. And so we have to stop that process in order to get your immune system functioning again. Otherwise, you keep compiling all these other infections, like these other viral infections and these other parasitic infections and leaky gut and food sensitivities and malnutrition because of that. And it's kind of a vicious cycle. So there are a number of different tests that we can run to help us identify, are you in this chronic inflammatory response state? And if so, then we put you on a treatment protocol to stop that and to reverse that. There's actually very exciting and promising research being done at George Washington University using genomics and transcriptomics. So with a blood test, we can actually now identify which genes are turned on and are those genes influencing the pathology that we see in the body. And when we can identify that, we can decipher, do you have active Lyme, or did you have active Lyme and you were treated and now you don't have active Lyme, you've recovered, but then there's other things we need to calm down. We need to calm down the inflammatory state, the neuroinflammation, the immune dysregulation, the hormone dysregulation. When we do that, we can turn off these genes, and there's a very specific therapy that we can use at the right time to actually turn off those genes that have been turned on. So that's a very exciting, well-published and validated tool that we're now going to start to use, and it's very promising because we can now identify with certainty what's going on in the body. The other thing we can do is actually look at an MRI of the brain with what we call Neuro Quant, and that can show us, is there atrophy going on in certain parts of the brain called from dendritic pruning. And that's when the dendrites literally start turning in on themselves to protect themselves from the threat of this Lyme or the co-infections. So we can actually identify that. We can also identify, are you someone with those HLA genes who's also been exposed to mold? Because often mold and Lyme will go together hand in hand, and it's because those tend to be the people with those HLA defects who just happen to have a genetic predisposition, an environmental exposure, and it keeps them in this state. And so we have to identify those things through a really good history, through a really strategic workup. And we want to use all these different avenues of being able to make that clinical diagnosis. There's unfortunately no one test that we can use, and there's no one symptom that we can detect. And so we have to be an investigator and really go on this journey with you to kind of put these pieces together. Then we also want to treat the terrain of the body. We want to get rid of those other viral infections. We want to get rid of the parasitic infections. We want to make sure that you don't have any nutrient deficiencies. We want to treat the leaky gut. And so there's a process involved in how we go about this. But when we can first identify the problem accurately, then we can put you on the right treatment protocol. And that's where I think it brings a lot of hope to people, because often they go from doctor to doctor to doctor not knowing what's going on, and the regular tests aren't showing anything. And so we have to get more creative, and we have to keep digging, and we have to keep going upstream in terms of the diagnostic process to figure this out. One thing I do want to tell you about is we have a number of various treatments. Notoriously, the conventional treatment for Lyme is actually antibiotics. And like I said before earlier, when you have an acute Lyme presentation with that bullseye rash and you get acutely ill, oftentimes we hope that you're going to respond well to the antibiotic and you don't need to use those antibiotics long term. Some people, however, do need those antibiotics. And that's been kind of the conventional treatment approach for decades. And what we found overall is that most people, some people do respond well to that, but most people by and large are not responding well. They may respond well temporarily, but then as soon as they come off the antibiotics, all their symptoms come back. And most people can't tolerate these drugs year after year after year. Plus, it's like an atomic bomb on the microbiome, and it just obliterates your microbiome. So your microbiome is that ecosystem within the gut that creates our immune system. And we need that microbiome to support us and protect us, to digest our nutrients, to do a whole number of things. But if that's completely obliterated by antibiotics, that's a big piece of the puzzle that's no longer working. So some people just will not tolerate antibiotics, and so, or they don't want antibiotics, and so we have alternatives. There's a lot of herbal antibiotics that we can use that are much safer. We can also use things like ozone therapy that has the ability to kill off bacteria, kill off viruses, kill off parasites, kill off fungus. So a lot of times when we're changing the terrain of the body, we have to go after all these organisms, and ozone is one of the quickest ways to do that. It also energizes the body and can recharge the mitochondria, and so that's another piece that plays a big role in the treatment. We have another therapy called endo laser. It's a photodynamic endo laser, and so we use various photosensitizers, medications that will activate the light, and we can give that actually IV, intravenously, and that will do similarly. It will kill off various organisms, bacteria, viruses, fungus. And so that's another treatment that we use sometimes in conjunction with the ozone. Another treatment that we have here is called the SOT treatment, S-O-T, and that's created by a lab in Greece called RGCC, and it's actually a very personalized treatment for infections, and especially Lyme disease and other viruses. And so what that is we can send your blood to this lab. They actually remove the DNA from your blood and they extract what's called messenger RNA. Messenger RNA can then be isolated and attached to whatever we're trying to treat. So whether it's the Borrelia burgdorferi or a co-infection, we can actually tell the lab what we want in terms of a treatment. They will attach that messenger RNA to the bacteria or to the virus, and then we give that treatment to you through an IV. And it's a very personalized treatment to train your immune system to go after that bacteria or that virus or that organism. And so that's a newer treatment that we're now offering that is very specific, very personalized, and is showing some great results in terms of helping your immune system mount the proper response. And we can also do it with various viruses. So a lot of people have both Lyme and other viruses, and so we can alternate and give that SOT treatment to treat both things in a certain order. And so those are basically kind of the other treatment options that we have. We want to kill these infections. We also want to look at the terrain of the body, and in doing so, treat the terrain, whether there's imbalances, whether there's nutrient deficiencies, there's other infections. A lot of people with Lyme have compromised detox ability, and that can be from a genetic standpoint, or it can just be because the toxic burden is so large and so intense that they tend to be people who accumulate other toxins like heavy metals, chemicals. And so we need to also help the body detox, because that's a huge burden that's suppressing the immune system. And so we need to help open up all those detox pathways and gently, very strategically start to detox these patients as well. And so it's a very comprehensive approach that we take, and it's not a quick, there's no silver bullet for Lyme. However, when we're diagnosing it properly and we're putting you on the right treatment protocol and we're watching these changes over time take place, it's very, very exciting and very promising. So thank you for staying tuned and listening to this video. If you have any questions, please write that into the comment section.